Thank you so much for joining this session today. We're going to be talking about our listening therapy program, the Safe and Sound Protocol. I'm just going to wait a couple of minutes for a few others to join. So in the meantime, if you would like to grab a coffee or tea to settle in for today's chat, now would be a great time for that. I am drinking a turmeric ginger tonic. It's made by a company near me. Myself and my team today, Sarah and Anita, are all from the Toronto area. And this tea is made in Hamilton, which isn't too far, but it's called Lake and Oak and it's delicious. I would highly recommend if you guys are looking for a new suggestion. In the meantime, I'd love to see where everybody else is connecting from today. If you'd like to pop that in the chat and maybe your professional designation or some modalities that you use, just so we can get an idea of who is in our audience today. Sarah, if you wouldn't mind to share some of that.
Of course. We have Boston, Michigan. Welcome. Atlanta, Germany, and Colorado, Portland. Wow. Oh my goodness. The chat is just going crazy. That's wonderful. Nelson, North Carolina, Kansas, South Africa. Thank you for joining.
Wow.
Denmark, Augusta, Georgia, Netherlands, Napa, London, New Hampshire, Israel. Welcome, everyone. I am trying to keep up. They keep coming in.
Wonderful.
Philippines, Egypt, Florida, Baltimore, Minnesota. This is awesome. I'm sorry if I missed. I'm trying to gather as many as I can. Australia.
We are well represented all over the world.
Represented.
It's fun to hear of Baltimore. I actually grew up in Annapolis, Maryland, so it's always fun to connect with somebody from Maryland.
That's awesome.
Well represented. Thank you so much for making the time. It sounds like it may be late for some of you. I really appreciate that. All right. I think we should go ahead and jump into it. So thanks so much for joining. We will be talking about our listening therapy program today, the Safe and Sound Protocol. This session is intended for professionals who are looking to integrate this program into their practice. So if you are already a provider or looking into this more so for yourself or your family, this may not be the best session for you, but you are more than welcome to stay and learn today with us. So I will be your host today. My name is Susanna, and I am a specialized program consultant here at MyUnyte. I work with professionals of all different types of designations, and I'm very excited to be here with you today. And I am joined by my wonderful colleagues, Anita and Sarah, if you would like to introduce yourselves.
Thank you, Susanna. My name is Anita, and I'm a client success consultant here at MyUnyte ILS. I've been around since August 2019, so my 3 years is coming up very soon. I have a background in X-ray as well as business management, and I'm really enjoying working with our customers to best support them. Sarah, to you.
Thanks, Anita. So my name is Sarah. I am one of our program consultants at MyUnyte ILS. I work very closely with Susanna and Anita to make sure that we're meeting all of your needs and addressing any questions or concerns that you have. My background's in social work, and I have over 10 years of frontline experience working with individuals with various needs and abilities. And so that is my passion, and I really enjoy being able to assist clinicians in answering their questions or making sure that I can get them connected with wonderful people like Susanna and Anita to make sure that their questions are answered by the best of the best. Back to you, Susanna.
Thank you so much for those lovely introductions. I'm just going to go ahead and switch here. All right, so I just want to touch a little bit about my journey to MyUnyte. I'm just going to see if I can switch to speaker view. Sarah, if you might be able to help me out on the technical end on that, please. So yeah, a little bit about my journey. I studied neuroscience up here in Canada, in which I took courses in a lot of different sciences, but particularly neuroanatomy, psychology, pharmacology. And I grew this appreciation for connecting the physiology to the way that we interact with the environment and feel inside our bodies. I also have many people close to me who have been affected by mental health conditions and also experienced my own challenges and really felt how they have gotten in the way from being the best version that I can be. So between having this personal connection and studying the prevalence and the cost and the lack of effective treatment for mental health conditions, it drove me to seek out alternative approaches that address the underlying theme in many mental health challenges, which is a dysregulation in the nervous system. And that's what led me to Unite, and now I work with professionals like yourselves. And so I just like to strip this down and just talk about what really drove me here, which is Unite's mission, and that is to guide each person to be their true self. And we believe that the ability to do that lies within the nervous system. And so it's our mission to guide every person to train their nervous system to be more aware, resilient, and regulated so that they can feel safe, happy, and healthy, and effectively respond to life's challenges. And one of the tools that has been instrumental in achieving this is Dr. Stephen Porges' Polyvagal Theory and Safe and Sound Protocol, which is what we will be talking about today. But first, I'd like to start by highlighting where within the nervous system we are working, and then I'm going to add in Dr. Porges' polyvagal perspective, and then move into how the SSP works as an application of it, talk about some of the nuts and bolts of the program, such as how to get started, and Anita will give us a quick tour of what the digital platform and app looks like. We will then open the floor for some questions and wrap up the session by doing a draw for one of the attendees today to receive a free SSP training. So be sure to stay until the end to see if you are the winner. So starting with the nervous system works like our internal software. It controls everything we do from feeling, walking, thinking, breathing. And the part that many people are familiar with is the central nervous system that's comprised of the brain and the spinal cord. But we have many other nerves in our body, and they work on the outside and make up what's called the peripheral nervous system and plug back into the central nervous system. And within this system, we have two major branches. Firstly, the somatic nervous system, which innervates all skeletal muscles and controls voluntary movement. And then on the other side, we have the autonomic nervous system, which is where we will spend the remainder of our time today. And it controls everything that is automatic, such as breath, digestion, and hormone release. And within the autonomic nervous system, we can break it down a little bit further to two major parts, the sympathetic and parasympathetic nervous systems. The sympathetic works like a gas pedal. It turns on the body to gear us up to react or defend ourselves. And so it'll do things like make the pupils dilate and increase heart rate. The parasympathetic system works like the brakes for the system to turn the body off antagonistically. So we engage the system when we're winding down for bed. And the primary nerve within the parasympathetic nervous system is the vagus nerve. It is the 10th out of 12 cranial nerves in that it plugs right into the brainstem, and it is the longest nerve in the body, so it reaches deep into the gut. Now, 20% of the fibers within this nerve are working like a braking system. So they're sending signals from the brain to organs to slow things down. But 80% of these fibers are sending signals from the periphery back to the brain and work largely like a surveillance system to inform the brain as to what's going on in the body. And for many people, the sympathetic and parasympathetic nervous system is the furthest that the autonomic nervous system breaks down. However, Dr. Porges' polyvagal theory breaks it down one step further, in that we actually have two branches within the vagus nerve. We have one that is called the dorsal branch. It's here in the gray. And when you hear dorsal, you can think of like a dorsal fin. It is closer to the back of the body and it reaches deep into the base of the trunk. And it largely innervates organs that are below the diaphragm, so digestion, etc. And then we have a ventral branch that sits closer to the front, and it innervates organs above the diaphragm like the heart, the voice box, and some within the face. And these branches came about in a hierarchical manner. For older species, they just had one parasympathetic nerve. They would crack out of eggs, they would slither away, but we had this shift from more primitive reptiles to mammals. And when the shift occurred, we needed to rely on our own species to take care of us and send us signals of safety or danger to inform us as to which part of the nervous system we should engage. And when this shift occurred, a new branch of the vagus emerged to govern heart rate. And when it did, it integrated itself within the nerves that are responsible for our social engagement system. And these are nerves that control things like facial expression, tone of voice, eye contact, and even the nerves within the auditory pathway that are responsible for our ability to hear human voice. And it's through these different pathways and their connection to the vagus that we subconsciously search for and send signals of safety or danger. Now that we've laid some of the groundwork for the physiology of the different states within polyvagal theory, let's discuss how that looks in the psychology, or how engaging these different neural pathways is manifested in how one feels and interacts. So starting from the bottom of the polyvagal theory ladder, we have the dorsal vagal state. In this state, the body decouples the survival or primitive parts of the brain from the emotional and thinking parts. So the signals are coming in, but they aren't really being linked with emotion or thought. And this is often manifested in dissociation, disconnection, and a feeling of numbness. And when a client's in this state, they can be very difficult to reach because they are not able to articulate how they're feeling most of the time. In the next rung of the ladder, we have the sympathetic state, which is linked to the emotional part of the brain or the limbic system. For example, in fMRI studies within patients with anxiety, we see a lot of activity in this area, and the brain is really prioritizing this reactive space in the brain. And it often looks like hypervigilance, impulsivity, and it also biases the system towards interpreting threat, even when it may not be present. And finally, we have the ventral vagal state. And in this state, we have full access to cognitive and executive functions. It's where we can reason, reflect, and be fully present with ourselves and our environment so that we're able to think through how we respond rather than just reacting. And something that can be very frustrating is trying to work with top-down approaches, particularly talk-based, when your client is in dorsal or sympathetic in one of these defensive states, because they don't have access to where your tool is coming in. And so it's our goal to give you a tool that works in a bottom-up approach at a level below consciousness. And this allows for the brain to break into this ventral vagal space so that your client is more open and present, and that the other work can be effective and well received. And this brings me to the Safe and Sound Protocol, or the SSP. Like the polyvagal theory, it was developed by Dr. Stephen Porges over about 2 decades of research. And at the base of it, it is a listening therapy program. It is designed to initiate a repatterning within the nervous system by engaging the social engagement system so that we can more easily tap into the ventral branch of the vagus nerve. And when we do this, it supports a shift to be more present, engaged, and connected, and respond to the environment in a meaningful and adaptive way. So how do we do this? The SSP at the end of the day really is just music. It's covers of songs that you and your clients would likely recognize that have gone through a computer algorithm. And this algorithm strips out the high and the low frequencies within the music, and it dynamically delivers the middle range in a progressive fashion. And it's done using over-the-ear headphones that don't have noise cancellation. And the reason that this middle range is so important is because it embodies signals of safety and trust for us as humans. It's what we use in safe human communication, and Dr. Porges often relates this to a mother's lullaby and how it affects a crying baby. But to take a look at how it works anatomically, I'd just like to point out to this figure here. So just to orient first, right here, this would be representing the external ear where the sound is coming in, and it first meets the eardrum here. Attached to the eardrum, we have 3 little bones or ossicles, and the last one kicks onto the inner ear where this acoustic stimulus is translated into neural impulses to be interpreted by the brain. We also have this very important little muscle right here called the stapedius. And the stapedius is innervated by a nerve. It's called the facial nerve. That's one of those nerves within the social engagement system. So it's connected to the ventral part of the vagus in the brainstem. Now, the top part of this figure is representing a client in a defensive state. So maybe you can imagine a client of yours who experiences a lot of anxiety. And so they often engage the sympathetic nervous system. And if you think about this client going into a coffee shop with a friend, they're going to be getting a lot of different types of acoustic stimulus in this situation. They may be getting high frequency of coffee cups clinking, low frequency of a coffee grinder, and then they may have a friend with them who's in this middle range having a conversation. And because this client has walked into this coffee shop today in a defensive state, their stapedius is not engaging. And so when this acoustic stimulus comes in, the last bone in this little chain is going to kick that inner ear a lot harder than it typically would. And this is going to amplify the high and the low frequencies within the sound. This is problematic for two reasons. Firstly, these high and low frequencies are primitively associated to alert or threat, similar to a distress call or a predatorial sound. And so this is going to reinforce the engagement of a defensive state. Secondly, it's also going to mask this middle range of sound frequency. And so the client is going to have a very difficult time being present and connected in the conversation that they're having. And that could be taken with offense by the friend that they're with. And so if we compare this top diagram to the bottom one, this is representing someone in a ventral vagal state, where the stapedius is actively engaged and they're able to attune to this middle range of sound frequency and stay present with it and interpret it over the background noise. Now, the way that the SSP works is by challenging the stapedius and the associated neural circuitry that we engage when we're in a ventral vagal state to stay engaged. And it does this over 5 hours that get progressively more difficult as the hours go on. And it does it in an interval training way. So it'll kind of switch in between these two states to challenge the stapedius to stay engaged. Now, the 5 hours are not done in one sitting. For clients who engage the ventral state rather easily, they might do it in 30-minute sessions over 10 straight days, and that is the fastest that anyone would ever do the program. But for clients who have lived in a chronic state of defense and have fallen into a learned disuse of this system, they might need to take a few more rest days or move more slowly. And that is perfectly fine. The protocol is still going to be effective and increasingly challenge this system. We do have assessments to help you determine the baseline of your client's nervous system, and Anita will be touching on those a little bit later. Alrighty, so as I've spoken about the SSP so far, I have talked about the SSP core, which is the part of the SSP that was how it was originally released, and it's still responsible for doing the bulk of the therapeutic work. But since its release to the public in 2017, we have added 2 complementary pathways to augment the listening experience. These pathways use the same music in the same order, but they're filtered differently to elicit different effects. So if we stick to my analogy of interval training, I like to think of our SSP Connect pathway as a dynamic warm-up. It has absolutely no filtration on it, so it allows your client to acclimate to the music and the listening process before adding in the therapeutic effects that come from the filtration. On the other side of that, we have the SSP balance pathway. And I think about this one kind of like a steady state cardio. It is less intensely filtered, so it's going to engage the same neural circuitry in a more mild way. It's a really great tool for your clients to use on their own to help them self-regulate and also to integrate the gains from the SSP core. Now, what I have mapped out here is just one way of using the pathways. However, every client's journey through them will look a little bit different. For example, sometimes clinicians will use balance before core just to further the warm-up process. So once you get comfortable, you can play around with those a little bit more. Alrighty, so let's just take a moment to look at the clinical evidence for the SSP. Dr. Porges led 2 clinical trials in 2013 and 2014 that investigated the effect of the SSP in a pediatric population with an autism spectrum disorder diagnosis. Now, ASD was initially identified for these trials due to the marked social engagement system dysfunction that accompanies this type of diagnosis, such as eye contact, vocal prosody, facial expression, sensory processing, and state regulation. However, these features are present in many other conditions as well. So the evidence from these studies can be translated to other populations and conditions such as ADD, anxiety, depression, and others. And we have seen that in some case studies. So just to talk a little bit about those studies, the first one noted improvements in the ability to decipher human voice over background noise, dichotic listening and receptive language, as well as a physiological measure of state regulation following the use of the SSP. The second study, which is what I have these figures from today, actually consisted of two different trials. So the first one was comparing the SSP core or filtered music to wearing headphones with no music. And in this study, they noted significant improvements in hearing sensitivity, spontaneous speech, listening, and behavioral organization. The second study compared the SSP core or filtered music to the SSP Connect or unfiltered music. And they saw significant improvements in both hearing sensitivity and emotional control. They also did a play-based assessment in this trial in which the active intervention or the SSP core demonstrated increased sharing behavior as well. We do have several other studies currently underway, and here's a quick snapshot of them. So we are investigating the SSP in trauma, Ehlers-Danlos syndrome, Parkinson's, chronic pain, as well as Olympic athletes. The preliminary results have been promising, and we are super excited to share them with you when the time comes. So who exactly is using the SSP? We work with many different types of professionals that leverage the SSP alongside various modalities to create individual treatment approaches for a number of different conditions and features. If you don't see the population that you work with or your professional designation here, please feel free to reach out to myself or someone on my team, and we would be happy to have a conversation with you to help you determine if the SSP would be a good fit for your professional setting. The important point to hone in on is that the SSP is not meant to be a standalone program. It's designed as an adjunct tool to complement the work that you as a professional are already doing. And it can influence your practice in several different ways. And I like to sum these up in the 5 Ps of delivery. Firstly, the SSP works to prime the nervous system and bring your clients into a space that is more present and aware so that you can dive deeper into the work that you're doing. It's also completely passive, so it's working at a subconscious level to create change. And it is portable, meaning that it's accessible to your client to have in the palm of their hand, and it's super easy to deliver in a remote setting as well. It works to promote and accelerate therapeutic outcomes and helps you and your client to overcome plateaus. Now, I am obviously very passionate about the SSP, so I may be a bit biased. So I just wanted to provide some testimonials from 2 of our providers. Firstly, Heather McDuffie, an LCSW, or from Washington, it requires new clients to go through the SSP because it makes the work she does faster and easier. And then Anna Duvalle, an OT and SEP from Colorado, uses the SSP to achieve results that would take 6 months or more in a regular therapeutic process. All right, so how to get started? There is a training involved. It's all online and on demand, so you can move through it at your own pace and revisit it at any point. It contains about 5 hours of content and covers techniques for how to use the SSP both in person and remotely. So it's totally doable in a Saturday if you have a free one. Next, you can access the music and resources through an active subscription and then begin integrating the SSP into your practice. Sounds easy. Well, we understand it's a large commitment to bring a new tool into your practice, so we do have resources and people in place to support you. So let's take a look at what those are. Firstly, we have the platform that we call MyUnyte. Anita will be giving us a tour of that in just a moment, but I'll go ahead and do a brief overview. The MyUnyte platform contains Unite Academy, which is where you will access training, assessments to get a baseline of your client's nervous system regulation, as well as measure changes. And then we have a number of wonderful resources for both you and your clients to help you use the program successfully, and a growing evidence base. On the other side, we have a wonderful team of people in place. Our client success team who are available for clinical and technical consultations, the clinical advisory board that includes experienced SSP providers in a number of different professional designations, a community of over 3,500 providers in over 50 countries, a client referral map where we connect individuals who are interested in the SSP to trained professionals, and then a number of events and partnerships with experts in the field, such as Dr. Porges, Deb Dana, and Kim Barthel. And with that, I will turn it over to Anita to tell us about what her team is all about and give us a tour of MyUnyte.
Thank you so much, Susanna. So I'm going to start sharing my screen here. So this is the client success team. So you are not alone once you subscribe to the SSP. You have a whole team here that is ready to support you so that you can best serve yourself and your clients as well with the use of the SSP. The kind of things that the client success team can help with can be anything related to clinical implementation, case consultation, any account related questions you have, technical support, and any billing questions that you have. So we're here for every step of the way. We're here to assist you. We're here to support you. We're here to chat with you. We want you to feel that you have the resources to be able to conduct the SSP in the best way possible for your practice. So I'm going to take a quick moment here and just pull up my MyUnyte screen here. So MyUnyte, this is what it looks like. And I'll give you a little bit of an overview of what MyUnyte is. MyUnyte is an online platform that is really your kind of hub, your SSP hub. This is where if you have an active subscription, you can add and manage your clients. You can give assessments to your clients. You can complete them with them in person as well, and your resources. And we have so many resources for you to make use of. And I'm not going to go through everything because there's a lot of stuff here that you can go through. But I'm going to touch on some really important pieces that will be of benefit to you all. So the first place I'm going to go to is the Clients tab. The Clients tab is where you would add and manage your clients. You can set your clients up for in-person delivery as well as remote delivery, depending on what you decide. This is also a place where you can view your clients' listening sessions, and I'm going to show you what that looks like. If I select this client here and go to View Client Dashboard, you're going to see a graphical representation of exactly what your client has listened to. You're going to see the programs, how much time, how many times they paused, and what days that they listened on. You can also filter here. You can filter by program, and you can also filter by day as well. This is a wonderful way to keep track of your clients listening and make recommendations to them through their listening journey. The next tab I'd love to go over is the Assessments tab here. So this is a new addition that we've made to MyUnyte, where you can actually complete assessments in person with your client and remotely as well. And what are assessments? Assessments have been created so that you can measure the impact of the SSP on your clients using a variety of sources and questions to kind of gauge where their nervous system is at and to see if there has been any impact from the SSP. I'm going to show you what assessments we have right now. And you can always assign it to a client. I'm going to assign it to this client over here. And you can see they already have one started, but I'm going to start a new one with them very quickly. And you'll see we have the Brain and Body Center sensory scales meant for adults as well as children, measuring sensory behaviors. And then the body perception questionnaire, generalized anxiety disorder, the GAD-7, and we have the patient health questionnaire, the PHQ, and the PTSD checklist for DSM-5. So these are the assessments that we have right now, and we are looking to expand this library and add more as needed and from the needs of our providers, such as possibly yourself. And I'm going to show you very quickly what it looks like when you complete an assessment. So if you set your client up remotely, you can always send it to them. But if it's an in-person client that you're going to be completing it with, you can start the assessment with them in person. So I'm going to quickly start this here. I'm not going to finish the full thing, but I just wanted you to get an idea of how it works. And I'm just going to be selecting these by random. So if I go like sometimes and then almost never, for example, these are the types of questions that can come up, and you can always save it and then complete it at a later time if needed. And you can do that by continuing over here, continuing the assessment. Something else I just wanted to show are the reports that are generated from this. I don't have a whole lot here, but you will be able to view your client's results once they finish the assessment, and there is a graphical representation of it, and you can go by specifics by client as well. So this client doesn't have anything, but you will be able to view that per client. I also wanted to take you to the resources tab. The resources tab has so many different tools and things that you can use in order to enhance your use with the SSP. So you can filter it, and I'm going to filter it by SSP here. And I'm just going to highlight some of the really important resources that we have so that you can utilize. We have the case consultation form. So this is if the client success team is not able to answer any clinical related questions that you have, we would refer you to this form where our clinical advisory board will be able to review your questions and get back to you. We also have the case study submission form. This form is if you have any wonderful SSP stories that you would love to share with us, and we'd love to hear it. And then this is where you can fill that out. And then we have the SSP provider toolkit. I'm going to come back to this one because I want to show it in more depth, but essentially this holds materials that you'll be able to educate your clients with and market the SSP with to better assist your practice. We have precautions here. We also have the playlists if you need to view them. And we have an intake form. So this intake form can be used before the SSP starts, and it's a really great way to gauge where your client's nervous system is at. We're in the process of adding it to our assessments, but it's not quite there. And we do have a recommendation form that goes with it as well. Just scrolling down, these are some other resources that we have. We also have monthly SSP Q&As where you'll be able to attend, and a member and a SSP provider that works with the MyUnyte ILS closely does run these webinars, and it's something that you get free access to as an SSP provider. And we do end up posting them here after, so you could always view older ones that we have. So just scrolling down here, these are more in-depth explanations of each assessment that we have. We have an ebook of regulating activities you can include with the listening, specific handouts that you can share with your clients. And we also have an infographic for titrating the music, so deciding how much listening is appropriate for your clients. And here are some other manuals related to our assessments. So I wanted to scroll back up and quickly show you in more depth the SSP provider toolkit. So how can we help you and your clinic to be able to market the SSP, to be able to explain the SSP to your clients? And that's why this SSP provider toolkit has been created. There's specially curated resources here that you are able to share with your clients, that you're also able to use on your website if you would like to market it, and also other educational resources for you as well if you'd like to learn a bit more. I'm going to scroll down and show some stuff here. So how to understand programs, how to help educate your clients, how to help you market Unite ILS products or SSP as well, and how to integrate it into your practice. I'm going to go to the Help Me Educate My Clients tab here. And these are some videos, books and articles that you can share. And these are things that you can actually download and share with your clients. There's some material that can be purchased if you want to make recommendations, some infographics that you can print out and have or email to your client. There are also videos that you can share with them if you want to help educate them more. And there's different books too. There's also free downloads here as well, so that you can just directly send it over to your clients. So perfect. So that is for the MyUnyte here. I'm going to stop sharing very briefly and quickly pull up the Unite ILS app. I just wanted to show you what that looks like as well, so you do have an idea. So just give me one moment as I do connect my phone. All right. Thank you for your patience. All right, so this is what the app looks like. So I'm just going to go over it very briefly. Because there's a lot of stuff here as well, but I wanted to highlight this clients tab. So you can listen in person or remotely with your clients on your device, and your clients can use their own devices as well if it's going to be remote. So you have the ability to continue sessions from where you left off, and also select new programs as well for your client to listen to. So I'm just going to go back to this tab here. And then I'm going to show you this programs tab very quickly. So these are all the programs that you have access to for the SSP. And Susanna has mentioned the pathway, so SSP Connect, SSP Core, and SSP Balance. And these are all the programs that are associated with each pathway. You have the ability to download it, and Wi-Fi is needed to do this in order to listen to the programs to get the best out of it. But this one I have downloaded here, so you can actually start listening to it as well. This preview mode is 20 minutes a day of listening, essentially, and if you wanted to sample the music for your clients without adding them, or if you wanted to listen to it yourself. If we go back to the clients tab here, the best way to serve your clients here is to, again, be connected to Wi-Fi or have a good data source so that they are able to effectively listen to the programs. I'm going to be stopping my sharing now, but I did also just want to note before I pass it back to Susanna that outside of this walkthrough I just did, we actually complete Success with MyUnyte webinars. And what this is a more in-depth walkthrough of the MyUnyte as well as the Unite ILS app once you get training and you get a subscription. So what I showed you is just a small tidbit of what we discuss in those webinars. So I want you to feel that you are supported. We are there to help. You won't be alone once your subscription starts. We have a variety of resources for you to use. And as you saw on MyUnyte, I didn't even go through all of the resources that are there, but just know that there's so much and you're not going to be alone when you do it. So thank you so much, everyone. Susanna, I'm going to pass it back to you.
Thank you so much for that lovely demo. I'm just going to go ahead and share my screen again. So now that we have an idea as to what comes with the subscriptions, let's talk about what they look like. I'm going to highlight the annual subscription. It's our most economical offer as it bundles both everything you need in the subscription, so the resources, the people, the platform, with the training for free. And the cost for that is $14.99 USD per year. Now is a really great time to act on that if you're interested, because we have teamed up for the second year in a row with the Psychotherapy Networkers Symposium. They are going to be having their conference in March, so you'll get free access to that as well. And it will include speakers such as Deb Dana, Ruth Lanius, Mona Delahook, and it includes up to a year's worth of CEUs as well. So if you're in need of those, it's a great place to go for that. And if you feel like this just isn't really quite the right option for you, we do have others. If Sarah, if you wouldn't mind just posting the pricing page if anybody wants to go take a look at those. Now I will open up the floor for questions. So Sarah, if you would please grant access for camera and mic. If you feel comfortable turning those on or unmuting yourself, please do so. You can ask questions directly or pop them in the chat, and I will do my best to get back to them before we conclude today's session with the SSP training giveaway. Looks like we have 2 hands raised.
Yep, I'm starting to just go through now.
Thank you.
Susanna, I think you need to let me be a co-host to be able to do that, but that's okay. I think we can do that if you would like. So I see we have 2 hands raised. What we can do is I can answer the first one of the questions here quickly, Susanna, to give you a few moments to get that. So why no earbuds or noise canceling? And that's a great question.
Yeah, that is a really great question. So the reason that we have over-the-ear headphones really is for an immersive experience. We actually have a branch of the vagus nerve, it's called the auricular branch, that innervates the external ear canal as well as some of the pieces of the external ear. And so we don't want to put an earbud on them. It adds a confounding variable, so we want to have it over the ear. The reason for the no noise cancellation is because noise cancellation emits a low frequency sound, and this can conflict with the middle range of sound frequency that is so crucial to the efficacy of the SSP. So really just standard headphones over the ear. We do make our own version that are wonderful, but if your client has them already or would prefer to purchase them elsewhere, they can do that as well.
I'm just going through to unmute, friends. Thank you for waiting. So what I'm going to do is, so that was a great one question. If you could all bear with me for the questions for just a moment while I get this everyone else situated. So we talked about, it was mentioned about forms. And so can parents fill out forms with the assessments that you were speaking about, Anita?
Really great question. So you as the provider, you can send it to parents if needed. So if parents will be managing child's listening or account, you can definitely send it to their email and they'll be able to complete it on their own. And then once they're complete, you can view their data. Another option is for you to do it in person with them if that's most ideal. But yes, you definitely can. I'm also happy to read through some of the questions, Sarah, as you are getting people to chat. There was another question over here about is the annual fee for a clinic or for individuals? Susanna, if you want to touch on that.
Yeah, that's a great question. So you can have as many providers as you want in a subscription. There is a limit, or all of our subscriptions include 5 active clients a month. So that would be any client that's listening to 30 minutes or more of any of the 3 pathways. So Connect, Core, or Balance. So you can have multiple clinicians using the same subscription if they are trained, but it is that $5 included client count. So if you go above that, it is a $10 charge per additional client each month. And if you find you're going way beyond that, we do have larger subscription options that might be more suitable for clinics. And I am happy to have a conversation around that. So I will, just while we're chatting here, I will pop up my contact information. If you do want to reach out, I'm happy to chat about that.
There was another question here about how long is the SSP training good for, and does it ever need to be repeated, or do you need to be recertified?
That's a really great question. So you'll always have access to the training. You can always go revisit it. It is online and on demand. We are oftentimes changing things up and adding things to make it better. So you would have access to that as we do that once it's paid for.
Great. And is the sound set for a certain frequency?
So as I had mentioned before, it's not set for one specific frequency. It's going to change over this range of a very narrow frequency. It does get a bit more broad as you go through it, just to increase the challenge of keeping the muscles and the neural circuitry engaged. So the SSP balance does use a more broad range of frequency, whereas core would be a little bit more narrow.
Awesome. And then Anita, we do have a few hands that are raised. If you could go through those questions. Thank you for waiting, friends with the hands raised. Still going through and allowing friends to unmute.
Sure. So let's see here. It looks like Brazilda, your hand is up here. You can unmute yourself and go ahead and ask your question.
I needed you study more. Thank you very much. I understand it a little. Thank you very much.
You're welcome.
You're very welcome. Thanks for coming today.
Wonderful. So Else Marie, it looks like your hand is also up. Did you want to go ahead and ask a question?
Mhm.
Myself, there I am. Hello.
Hello.
Hi, Else Marie.
Hello. I'm from Sweden. And
Welcome.
yeah, thank you. Thank you. And I am a psychotherapist, but in this case, I'm first a grandma because I have got a little grandson who's 9 years old and have a hard time. So I'm very interested in how I can provide him and myself too, I think. And I wonder if there is some people in Sweden that you know who are working with this. And if because I'm not so used with the English language and the technique, you know. So yeah, I will be more safe if I could speak my own language.
Absolutely. We do have, as I mentioned briefly earlier, we have a provider referral map. And so this provider map contains all of our professionals who have chosen to be on it from around the world. So we do have some in Europe, in Sweden. So if you wanted to go that route, that's a great option. You, of course, could also get trained. And if you were just looking to do it for your grandson, you could do a shorter subscription. We do have a 3-month subscription. It's kind of more of a trial just to kind of get a feel for it. So you could do that option, or go through a different provider that we could link you up with.
Nice. So where can I find that information?
We can send you an email with that information, Sarah, if you don't mind just taking.
Yes. I would
Wonderful.
love that.
Of course.
Thank you.
Absolutely.
Thank you.
Looks like we have a few more raised hands here.
Mm-hmm. Neil, would you like to go ahead and ask?
Yes. Okay, so I'm a developmental DIR floor time therapist, and so a large part of the population I work with is the early intervention populations. I work with families and their toddlers, and so I do not expect a 2-year-old who's highly mobilized in a high sympathetic state to wear a headset. How can this work in with that type of population?
That's a lovely question. Anita, do you want to take a crack at it, or I can take it?
Susanna, why don't you go ahead, and then I'll chime in if needed.
Sounds good.
I suppose what I'm asking is, we don't expect typically a typical neurotypical 2-year-old to sit still. let alone a 2-year-old who is highly sensory, overreactive, over-responsive, mixed responsivities, highly mobilized. So is there a way of having them at moments without wearing a standard headset to facilitate this?
Absolutely. And so a really great place to start with this type of client would be with SSP Connect through ambient speakers. And the SSP does not need to be done completely still. So if that's not feasible, and for many people it isn't, that's completely fine. You could do tactile, vestibular, sensory pieces at the same time. And that is how we'll often see it being done. It is recommended to use the headphones to have that immersive experience. However, if that is completely unfeasible for the client, something is better than nothing. And so ambient speakers could potentially be an option if the headphones was something that wasn't going to work for that client.
Thank you.
That was a great question.
Yeah. Looks like we have a couple more hands here. I'm seeing Lucinda. Lucinda, do you want to go ahead and unmute?
Okay, thank you very much. I have a client that has extreme auditory sensitivity due to vestibular migraines. Has a really hard time tolerating certain levels. Just wondered if this will work for her.
Yeah, so it absolutely may. I think something that is important to note is that it's not meant to be very loud. And so the SSP is done at the lowest volume intensity that the client can hear. And so using it at that point and maybe just doing 5 minutes every couple of days to really allow the nervous system to warm up to the program might be the way to do it. So playing with the titration, playing with the duration of and frequency of sessions is how we would generally see that type of client move through the program.
Thank you.
Okay.
I see your comment, Donna. I will add the pricing slide again. It looks like I sent it to the panelists instead of everybody. My apologies.
Okay, and Johan?
Yes, hello.
Hello.
Do you hearing me? Yes, can you
Yes,
hear
I
me?
do hear
Yes.
you.
Yeah, thank you. I'm very much interested in the SSP program, and I have a few patients who are suffering from tinnitus, and I'm asking of the question whether there are some experience about administering this kind of training to people with tinnitus.
That is a wonderful question, actually one we hear quite a bit. And we have gotten mixed feedback on this. So for many people, it can help reduce tinnitus. For others, we sometimes do see a transient increase or creation of tinnitus if it wasn't there before, that generally dissipates over a couple of weeks and then will go away completely. So we have heard kind of both ends of this spectrum. I actually read a study recently that was looking at a different type of vagus nerve stimulator. Ours works acoustically. This one worked transcutaneously, but it showed in fMRI studies that there was a decrease in the brain regions that are responsible both for the production of tinnitus and also the associated annoyance from tinnitus. So there definitely is potential that we've seen it absolutely positively influence tinnitus.
Because I think this, what I get also from my own experience, that this SSP plugs in very nicely into my own audio sensitivity, and so I think it must be a good means to be using for that, and I'm quite eager to try it out.
Absolutely. If you need any help getting started, or have any other questions, I would be happy to assist with those. I see that we're coming close to the end of our time today, so I'm going to take.
I'm almost done. Watch this. Watch.
So I'm just going to take one
not doing
more question. It looks like we have one from Susan.
Oh, you're doing great.
If you'd like to unmute.
Yes.
Hi, Susan.
Hi. Well, wait a minute. I'm trying to find unmute.
Oh, you're unmuted. I can hear you.
Okay, great.
Yes.
Great. So I am interested in how does one as a clinician incorporate this into my regular therapy? I know insurance usually pays. That's what most of my clients expect. And then when I bring this up, and do I talk to them about the cost? Will I get support? How do I add this into my regular practice? I feel like I'm being an ophthalmologist who is a doctor, but then now you need glasses, and now the glass system comes in. And so I need some, thoughts about that. How to incorporate this?
Yeah, wonderful question. So firstly, I'll just address the insurance part first. So because the SSP is a more novel approach, it doesn't have its own CPT code. So the way that many clinicians will use it is by pairing it with the work that they're already doing and billing for it under that. Within a setting, generally how we see it billed for is as kind of like a bulk fee. So it would include both your time as well as access to the program. In the sessions, you'll want to dedicate some of them to some psychoeducation, learning about polyvagal theory, how they feel in the different states, and then do some listening together. For some clients, you may want to do all of the listening together, and that will just depend on where the client's nervous system is at. For some clinicians, they will use the SSP for part of the session and then move into some of their other work for the remainder of the session. Generally, they do either add it in, so they will like I mentioned, they will add it in and charge for the fee for the cost of the session, and then add a cost for access, or they will just do a bulk fee for all of that up front. Okay. And if you want to, we can talk on this further if that would be helpful. I'd be happy to book a time with you to talk more about that.
I would like to have a further conversation about that.
Wonderful. Thanks, Susan. Yeah. Alrighty. Okay. Just because we're wrapping up today, I'm so sorry I didn't have time to get to everyone's questions. Please feel free to reach out to me. I'm happy to address them, or someone on my team. And I just want to make sure that we have time for one last thing. We want to do a free SSP training draw. So Sarah, if you don't mind helping me with that, this will be for an eligible provider, and we'll reach out to you later today with the details. So Sarah, drum roll, please.
Thank you. I'm just hitting my randomizer now. All right. The winner is Natalie Campbell. I really hope I pronounced that correctly.
Congratulations, Natalie. We will send out an email to connect with you later today with some next steps for that. Thank you so much, everyone, for joining us. It's been an absolute pleasure and an honor to be your host today and get to share something that I am so passionate about. And I look forward to having the opportunity to hopefully connect with you all in the future. I will just let you know we have several Q&As coming up next week with experienced SSP providers. If you are eager to learn about those, please reach out and we can get you connected with the registration links. Well, I hope everyone has a great rest of your day. Thank you so much for attending, and look forward to connecting with you all soon. Bye.
Awesome.